Joining me today from his home office, as many are now, is former MP for Muskoka and, more importantly, the former Health Minister for Ontario, Tony Clement.
Nice to be on the program.
Thanks, Tony. I know we've had you a couple of times just before things really got bad, but we are now going to be checking in with you to get some insights with where we're at now. I know this is way beyond your experience with SARS, but again, some valuable insights from you. And I'm just curious to start this off. How do you relate this to SARS now?
Well, SARS obviously killed 44 Ontarians, and we had about 10,000 people in quarantine. So this one is already much more severe and much more widespread throughout the country. There's no question about it. I'm also thinking and remembering about the Easter time, because I remember during SARS that the Easter time period was the period where we were going to make or break it, whether we were going to break the back of SARS and get back to some normalcy soon enough in a couple of months, or whether it was just going to run rampant out of control. And I remember talking to the Archbishop for Ontario and various other religious leaders who were celebrating Easter and saying, can you hold back on, hugging people and shaking hands and passing cups and all those kinds of things, because we don't want SARS to spread. So in that sense, it's analogous to what happened in 2003. But obviously now we don't have church services or other religious services. We're practicing physical distancing like we never did during the SARS outbreak. So that this, in terms of degree and in terms of impact on everybody's lives, this is unprecedented, of course.
Tony, during the SARS epidemic, you had actually put people in quarantine. That is not a situation that's technically happening right now. I know people are in self-isolation. Some are I guess you could call it quarantine if they're returning from a trip or have been in contact with someone with COVID-19 or have been infected. Should the province be looking at mandatory quarantines at this point?
So here's the thing about quarantine. Back in 2003, we knew every single case of SARS and how it got to that person. We were able to connect the dots. Our public health people were amazing. They were able to connect the dots. If person A got SARS, we knew it was from person B, and person B got it from person C. Here, we're way beyond that. It's called community spread. It means you don't really know. You can't really trace all of the cases of COVID-19. And part of the problem is there's a lot of asymptomatic people out there, people who don't display any symptoms, who don't even know they have COVID-19, who are spreading COVID-19. So in that sense, it's very different from the SARS situation. So I think that the rules that are in place right now is even if you have no symptoms, we want everybody to stay inside as much as possible. Maybe go for a walk. We're lucky we're in Muskoka. You can go for a walk and not meet up with anybody. But that's about it. Buy some groceries, visit your pharmacist. That's about it. And if we follow those rules, we will slowly get to the point where it is manageable. Will we be in a position where there are 0 cases of COVID-19? I highly doubt that. I think that it's in the community now, and it'll continue to spread until we find a vaccine. But what we're doing right now is buying time for the vaccine research to happen, and we're also buying time for our hospitals to be better prepared for the crest of the wave.
So we're about over 4,000 infections now, and I think just over 100 deaths in the province. I believe Italy was tens of thousands before they went to a lockdown situation. Could we be looking at a possible lockdown situation in Ontario, do you think?
I think they're going to try to stay with what is happening now, hoping that will crest the wave. And what I'm more interested in actually is how do you define victory in this situation, James? Because, a public health officer might say victory is 0 new cases for several weeks. Well, we may never get to that point. That this may be still burning its way through the population, unfortunately, for months on end. And the issue is, can we lock down for months on end? And the answer is no, we can't. You say, can they lock us down? But you still got to get to the pharmacy. You still got to buy groceries. I mean, you can lock down people for 2, maybe 3 days. That's it. But you can't lock down people for 14 days and expect it to be adhered to. So I think that we're getting into the debate about what does victory look like? How do we unwind the lockdown? Despite the fact that COVID-19 is still, around, hopefully fewer cases per day, fewer fatalities per day, but still around. And we're going to have that discussion as a society.
So Tony, again with SARS, I think there was some repetitiveness to that seasonally. Not as obviously as bad as the first time around, but there is some discussion now about COVID-19 being a seasonal affliction. So if we see that happen, if we see something like the flu season where it kicks off in October, November again, could we be looking at another scenario like what's happening right now where we're back to social distancing and being locked down for 14 days?
Well, the first part of the answer to your question is that's what the public health experts are saying, that it could be seasonal. It's speculative right now, but I think they're operating under the assumption it is. The key difference would be, though, that we have a vaccine. If we develop a vaccine by the fall, if it's readily available by the fall, and if we can inoculate, tens of millions of people around the world, then it is a game changer in terms of not being as disruptive as the first go round. So that's what everybody's hoping for. And I guess you got to hope that the coronavirus, I don't want to scare anybody, but you got to hope that the coronavirus doesn't mutate, which sometimes happens with these viruses, to a more virulent form. That's exactly what happened with the Spanish flu, when Spanish flu part 2 happened in the fall and was more virulent. So I'm sure that the epidemiologists are looking out for that as well.
All right. Well, Tony, I could pick your brain all day, and I appreciate this unique opportunity to have an inside talk about what's happening on the government side of things. But we do need to go to a break. We will chat with you soon again just to get some more insight in this, but I appreciate you taking the time.
Well, I'm not going anywhere, so I'd love to have a further chat with you. That'd be great. Thank you.